Welcome to Untold Physio Stories podcast, your perfect commute resource with physio failures, successes, interesting cases, and more from the physio and rehab world, with your hosts, Drs. Andrew Rothschild and Erson Religioso. If you've had dreams of starting your own side hustle, make sure to check out Curve Health Online. They have an iPad, iPhone, and Android app, and they only take home 7% of whatever it is you charge. Otherwise, it's free for their all-in-one computer vision, exercise library, HIPAA-compliant messaging system, and telehealth platform. Again, check it out at modmt.com/curve, C-U-R-V, and make sure to tell them Dr. E sent you. Welcome back to Untold Physio Stories podcast. I'm one of your hosts, Dr. E, with Modern Manual Therapy, Edge Mobility System, and be sure to check out the Eclectic Approach, my new online and free private social network for PTs and rehab pros. You can check that out at modmt.com/members. Today, I have one of my colleagues, friends, and Modern Rehab Mastery mentors as co-host. It's Dr. Sean Wells. How's it going today, Sean?
I'm doing great. How are you, Dr. E?
Good. Sean has written some books, and he's also the main instructor for Modern Nutritional Rehab. He has his own website, Nutritional Physical Therapy, where you can get certified as a PT or other rehab pro in nutrition. And let me tell you, it is an informational, dense seminar, but you will learn a lot, more than you ever could possibly learn. Sean has forgotten more than I know about nutrition, so he's a real expert.
Thank you. I appreciate it, Dr. E. And I love sharing knowledge, and I love being engaged with the nutrition and seeing how it can help our clients. It's amazing.
For sure. So what's the story you got for us today?
Well, so I was recently asked to speak at a conference, sports medicine conference at Disney World, and I was really excited. And the focus was on orthopedics for older adults, and it was supposed to straddle kind of the continuum, sort of a holistic type of approach. So not just interventions like exercise and modalities and things like that, but also touching on some of those lifestyle factors, particularly nutrition. And so I was hammering home some of the key factors with older adults, talking about nutrition, like reducing alcohol intake and maybe some supplementation. And that really seemed to pique their interest, the notion of certain supplements. And as you probably know from your experience with me, Dr. E, and some of my courses, I'm not a huge supplement person, just because the risks of possibly getting something that's tainted or it's unregulated. You don't really always know what you're getting because it's not well tested, right? So I really try to make it clear in my presentation. Supplements, there's some that are out there that could be effective, but for the mainstay for our orthopedic population and older adults, good nutrition and exercise, sleep, those sort of factors can really go a long way. And so after the conference, I get pulled aside, and a gentleman comes up and he says, "Sean, great discussion. I really like it, but I just have to ask you, have you ever tried something called collagen supplementation?" I kind of laughed. I said, "Well,
have you ever heard of collagen supplementation?"
I personally have never tried it, but I've read some literature about it, and I've had some clients ask about it. And this guy was really interesting. He was a PT ATC, and he said, I exercised all my life, and as I reached 40s and into my 50s, I noticed I just was really stiff and achy. And so one of my friends had recommended it, and so I tried it. I put it in my coffee every morning, and it made a huge difference. I said, okay, wow, that's interesting. Sample one, maybe it worked for you. I don't know if it really would work for me as well, but not that I need it, but some of my clients as well. So I said, I'll have to go back to the literature and look around. Well, sure enough, as this gentleman is talking, another gentleman comes up and says, "Hey, great lecture, by the way. I have a question for you." So what's the question? He goes, "Have you ever used collagen supplementation?" I said, "Oh my gosh." Wow, there must be a message here, right? So I told him the same thing. No, never. The literature I pulled up, and is limited in terms of what it's suggesting right now in terms of its benefits for arthritis and joint pain and joint stiffness. But I'll go back in the literature and I'll look and see what comes up. And so as we're chatting and talking, I'm just curious. I said, well, what are you buying? Like, show me what you got. I get it off Amazon. They show me the label. And then Dr. Kelly Anderson, she's the program director over at University.
Were they both buying the same supplements?
It was actually one was different, and the one gentleman who I first ran into actually was taking the same supplement as this third person, Dr. Henderson, who came up. She's the program director at UWF for the sports med program there, and she comes in and says, "What are you guys talking about?" She was kind of the lead in terms of the conference sort of MC, as well as the person that my main contact that I knew from teaching at Florida Gulf Coast University, and she says, "What are you guys talking about?" It's, "Well, we're chatting about this thing called collagen supplementation." She says, "Well, I take that too." "Are you serious?" She goes, "Yeah, I've been taking it now for over a year. And I can tell you, it's amazing the difference I could feel in my body when I'm lifting." And I said, "Well, what are you taking?" And then she showed me the label, and it's the same label that this guy's taking from Amazon. And I said, "No way, this is crazy." So you guys are all three of you taking collagen. So there must be something in the collagen supplementation that I need to look at. And the specific brand, I have no affiliation with it. I believe it's Collagen Peptides. Orgain makes a grass-fed version of it, but they put a scoop of it. I guess they get the chocolate one. They put a scoop of it in their coffee every morning, about 20 grams. And they said it made a significant difference in their stiffness. So I said, well, that's it. When I get home, I'm going to go and pull some new literature. So I went to examine.com. Have you ever checked out examine.com, Erson?
No, but you talk about it a lot online.
Yeah, it's a great resource for PTs, OTs, rehab professionals. It's really evidence-based. You pay for a membership now. There's a free version that's scaled down information, but for the paid version, for me, I really enjoyed the paid version because they give you very detailed summaries of the research. Because let's be honest, some of these research articles are really long, and reading it all, sometimes trying to condense hundreds of articles, it's a lot of work. So Examine does a lot of that work, summarizes it, ranks it based on quality, what's the overall findings, maybe what's the dosage. And so it's real easy and digestible information. So I went to their website and pulled some of their current research on collagen, and found there's actually been some newer studies coming out showing that there could be some effectiveness with collagen supplementation of about 20 grams, 15 to 20 grams per day, and helping with joint stiffness and arthritis. Now, does that mean it reverses it? No. Does that mean you should stop exercising and not watching your diet, not cutting back on alcohol and sugar, etc.? No, but it definitely seems to have some benefit in regards to perception of joint stiffness, numerical pain rating scale. And I know we always talk about statistics on that one too, because like when we look at numerical pain rating scale of like, oh, there's a statistically significant difference of 0.5. That's not really clinically meaningful to most of our patients, but a lot of these exceeded those, like a 2 out of 10 on that numerical pain rating scale, as well as they also had other metrics.
2 points better?
Yeah, 2 points better. Yeah. And they also looked at like functional scales too. Patients were able to like perform better on things like the not the oswestry, but the knee, was it the KOS, the knee functional scale. So there's some other metrics there other than just pain. So I think overall it's pretty promising to see some more current literature coming out on collagen and its use. There's a bunch of different collagens, and that's important to see. And I know I wrote a little blog post about it. In terms of peptides, hydrolyzed proteins, collagen 1, collagen 2. There's different ones that are out there, denatured, undenatured. So it's important to look at that. And I definitely encourage you to check out the resource either on the blog post that I think you shared the blog post, right, on your feed.
Yeah, I think so.
Yeah, check it out and read what specifically has been examined. But I think over the next 5 years, we're going to see more research on collagen in terms of dosing and specific types and parameters for specific conditions. Because I know there's some individuals, for instance, that have no cartilage left, right? On imaging, they're at like the worst type of grade of osteoarthritis, like on the 4 on that Collagen scale or whatever. Those individuals actually don't get a really strong response with collagen. So in some regard, people say you need to have some cartilage left in order to see some benefits for that collagen supplementation. So something to consider.
Interesting. Yeah. We only know what we know, and we don't know what we don't know, right?
Yep. Yeah, it's amazing.
It's good to have your biases challenged, because I wonder if you had just encountered the one gentleman, would you have ever gone down this route, right?
Probably not.
Yeah,
Again, yeah,
probably
like
not.
you
I
said,
wouldn't have either. That's like someone asked me like, "Hey, have you ever heard of mechanical traction?"
yeah,
You know?
okay, nope.
Right. And then all of a sudden, like three people are like, I'm using this traction for all my neck patients, and you really should check it out. And all of a sudden I go back and look at like, oh, there's actually literature now that shows that traction is not merely just a passive modality, which I don't know. I don't know. But
Yeah.
anyway, let me tell you this anecdotal story. There's a gentleman who I had been seeing way early in my career. I was probably only 1 or 2 years out, so I didn't know anything about pain science or mostly active strategies. I was just like in finishing manual therapy fellowship and really heavily into the passive approach in the uh, early 2000s and late 90s. So this guy I was seeing for knee OA, he had a lot of knee stiffness, a lot of knee weakness, but also um, his nails. He showed me this very early on in his treatment. Now seeing this guy for months, before I was like I was seeing people like 20 to 30 times early on in my career. His nail beds were like I don't know how to describe them, but they were almost like Pringles.
Okay.
They were just so rough. So then he's like, "Hey, have you ever heard of collagen supplementation?" And back then, I definitely had not heard
Yeah.
of collagen supplementation. He's like, "I'm going to try it. What do you think?" And I'm like, "Well, I don't know. I mean, you might as well try it. I don't really know much about it." And I think I looked some up, and they probably said even back then, "Oh, anecdotally, it helps with knee stiffness or OA." I'm like, I don't think it could hurt. So not only does this help significantly help his knee stiffness in OA, he's better able to tolerate the strengthening. But after a couple months, he was done. Like he was kind of ending his therapy at that point, like plateauing. He comes back maybe like 4 to 6 months later, and he shows he's walking better, he's moving better. I don't think he has a cane anymore. And then now he's like, and look at my nail beds. His nail beds were perfectly normal.
Oh, wow.
So that I was
Man.
like, whoa, there must be. That's where I was like, there must be something to this because as an N of one, just like the strike. I'm like, if this is doing something on the outside, it's probably doing something on the inside.
Yeah, absolutely. That's fascinating. And I first got exposed to collagen supplementation. It wasn't even supplementation, but it was actually my wife's very good friend in Orlando. She is Taiwanese. And so she was on a very traditional diet and said, have you ever eaten, like beef tendon? And have you ever eaten some of these basically animal type products? I said, I don't really eat a lot of meat, so beef tendon's probably not high on my list. And she said, well, the beef tendon's got.
It sounds really like super tough jerky. Like
Yeah,
tendon.
yeah.
That
I was
is
like,
the
I
part
don't
that I would
know,
not choose to eat.
right? We choose like, if you're gonna have meat, what do most people choose? They try to choose like the best cut. In this
The
case, you're
meaty
like,
part, right? Not
yeah,
the worst
not that.
part. Yeah.
Yeah. And so she said, "Wow, beef tendon's great for you." I said, "Well, what does it do?" She goes, "Well, it helps with your skin, your hair, and your nails." And I thought, well, I'm not too worried about my skin and my hair and my nails. But fast forward, 15 years from now, and I'm going, wow, maybe I should be thinking about this more than just skin, hair, and nails, because there's something else maybe, within the
Right. That's
joints
just
that's
like
beneficial.
right. I mean, obviously, again, what is it doing to you inside? If it's not like it just is going all throughout your body and circulating and only affecting the outside.
Exactly.
Yeah.
Yeah. It's a
Awesome.
really cool little story, and I was really excited, and like definitely a clear message that I need to challenge my bias, look at the research, and kind of be open to new ideas too, particularly around nutrition and how it can help our clients.
Yeah, for sure. Awesome. Well, thanks for coming on. Where can people find you, Sean?
They can find me at www.nutritionalphysicaltherapy.com or at your website, modern nutritional rehabilitation.
Right. And he's also part of the Modern Rehab Mastery program. You can earn
Yes.
over 30 CEUs, 4 to 6 months with 4 mentors. Check that out, modernrehabmastery.com. All right, guys, if you have any comments, suggestions, crazy physical therapy stories, big physio failures, or interesting cases, make sure to reach out to Andrew, myself, or Sean online and get on the podcast. And as always, subscribe. Hit that subscribe button. Please give Untold Physio Stories 5 stars and share our podcast. And as always, you guys have an awesome day.
Take care.